Many men, especially as they age, face a silent health struggle, one that often goes unspoken and can dramatically affect their quality of life: prostate problems. As many as 50% of men over the age of 50 experience some form of prostate enlargement, with this number rising as they grow older. The prostate, a small gland located just below the bladder, plays a crucial role in male reproductive health, but when it becomes enlarged, it can cause significant issues. The condition, known as benign prostatic hyperplasia, BPH, is not life-threatening, but it can lead to frustrating, even debilitating symptoms that disrupt daily life. Imagine waking up multiple times during the night, not because you're restless, but because your bladder seems to have a mind of its own, urging you to get up and run to the bathroom. The constant urge to urinate, weak urine flow, and difficulty fully emptying the bladder. These are just a few of the struggles men with an enlarged prostate deal with every day. The symptoms can interfere with sleep, work, and even relationships. While these issues are often brushed off as a normal part of aging, for many, they can seriously affect well-being. But prostate health isn't something that should just be endured. It's a condition that deserves attention, and perhaps more importantly, it deserves solutions that are accessible and effective. In today's medical world, the options available to manage prostate health are varied, from lifestyle changes to medications and even surgical procedures. However, not all of these options are ideal for everyone, especially when considering their costs, side effects, and long-term effectiveness. What if there was a simpler, more natural approach? One that didn't involve expensive prescriptions or invasive procedures. This is where a fascinating piece of medical history comes into play. Today, we'll be diving into a remarkable Soviet-era treatment that gained popularity for its effectiveness in treating prostate adenoma. It may sound surprising, but this treatment was known for its simplicity, affordability, and most importantly, its ability to provide relief in a matter of days. In the coming sections, we'll explore this treatment in detail, understanding how it works, what science says about it, and why it might still be relevant for men dealing with prostate issues today. Stay tuned, because this is not just another miracle cure. This is a proven method, backed by both historical knowledge and modern research, and it could change the way you think about prostate health. Prostate adenoma, or benign prostatic hyperplasia, BPH, is a condition that most men encounter as they age, and it's crucial to understand what's happening in the body during this process. The prostate, which is roughly the size of a walnut, surrounds the urethra and plays a key role in producing seminal fluid. As men age, hormonal changes, particularly a rise in dihydrotestosterone, DHT, cause the prostate gland to enlarge. This enlargement doesn't mean cancer, but it does create a range of bothersome symptoms that can significantly affect quality of life. The initial stages of BPH might go unnoticed, as the symptoms develop gradually. Men may start to experience a weak urine stream or a sense that they haven't fully emptied their bladder. These early symptoms are often mild enough to be overlooked or attributed to other, less serious causes. However, as the condition progresses, these issues become more pronounced. Frequent urination, especially at night, is common, causing disrupted sleep and increasing the risk of developing other health problems due to poor rest. In severe cases, BPH can cause acute urinary retention, which is an emergency situation that requires immediate medical attention. The primary culprit behind BPH is the hormonal imbalance that occurs in older men. As men age, testosterone levels gradually decline, but the conversion of testosterone to DHT increases. DHT is a potent androgen that can stimulate prostate growth. This process is compounded by changes in the balance between estrogen and testosterone levels in the body. While the exact reasons for this hormonal shift aren't entirely understood, the result is clear: an enlarging prostate that begins to interfere with the normal functioning of the urinary system. While age is the most significant risk factor for BPH, other factors can contribute to its development. Genetics plays a role, as men with a family history of prostate issues are more likely to develop the condition. Lifestyle factors such as obesity, physical inactivity, and poor diet can also exacerbate the situation. In fact, studies have shown that men with a higher body mass index, BMI, and those with poor dietary habits, particularly diets high in fat and low in fiber, are at a greater risk of developing BPH. High blood pressure, diabetes, and heart disease have also been linked to an increased risk, suggesting that overall health and prostate health are deeply interconnected. The symptoms of BPH can be quite distressing, and in some cases, they lead men to seek medical intervention. Conventional treatments include medications like alpha blockers, which relax the muscle tissue in the prostate and bladder neck, and 5-alpha reductase inhibitors, which reduce the production of DHT. While these medications can offer relief, they often come with side effects such as dizziness, sexual dysfunction, and fatigue, which can make them undesirable for some men. In more severe cases, surgical options, such as transurethral resection of the prostate, TURP, are considered. However, surgery is invasive, carries risks, and may require a lengthy recovery period. For many men, the prospect of long-term reliance on medications or undergoing surgery can be daunting. This is where understanding alternative treatments becomes crucial. Natural remedies, particularly those with a historical track record of success, offer a less invasive and often more affordable option. Many of these remedies focus on lifestyle changes and dietary adjustments that can help manage the symptoms of BPH without resorting to pharmaceuticals or surgery. In the following sections, we'll explore one of these treatments in particular, a Soviet-era method that became popular for its simplicity and effectiveness. While it may seem surprising that such a remedy, often overlooked in modern times, still holds potential, there's a compelling case to be made for revisiting the past. The Soviet healthcare system was known for its focus on accessible and practical treatments that didn't always rely on expensive drugs or complex procedures. This particular remedy was used by Soviet urologists to treat prostate adenoma with remarkable results. Understanding how it works and why it might still be relevant today is the key to unlocking a new approach to managing prostate health. In Soviet times, medical professionals often faced a unique set of challenges. With limited access to expensive treatments and medications, Soviet healthcare focused on natural low-cost remedies that could be easily distributed to the population. One such remedy gained widespread popularity in the treatment of prostate adenoma, and it came from an unexpected source: a simple yet highly effective natural ingredient. This treatment was both inexpensive and powerful, proving to be a game-changer for men suffering from the symptoms of BPH. It was so effective that it became a staple in the toolkit of Soviet urologists and was considered one of the most reliable ways to address prostate issues without relying on harsh drugs or surgical procedures. The treatment in question is none other than pumpkin seed oil, a humble and easily accessible substance that has been used for centuries in various cultures for its health benefits. The Soviet-era urologists discovered that pumpkin seed oil, when taken regularly, could help reduce the symptoms of prostate enlargement. Rich in phytosterols, zinc, and omega-3 fatty acids, pumpkin seed oil helps reduce inflammation, improve urinary flow, and promote overall prostate health. These components work in harmony to shrink the prostate gland, alleviate urinary symptoms, and even restore normal function in men suffering from BPH. The science behind this is quite fascinating. Phytosterols, which are plant compounds found in pumpkin seeds, have been shown to inhibit the activity of enzymes that contribute to prostate enlargement. This helps to reduce the size of the prostate over time. Additionally, zinc is a critical mineral for prostate health, and studies have shown that zinc deficiency is often linked to an increased risk of prostate problems. By providing the body with the necessary nutrients, pumpkin seed oil offers a natural way to support prostate health and potentially reduce the need for more invasive treatments. In addition to its nutritional properties, pumpkin seed oil also contains antioxidants that help combat oxidative stress, which is believed to contribute to the development of BPH, chronic inflammation in the prostate is a key factor in the progression of the condition, and pumpkin seed oil's anti-inflammatory properties can help reduce this inflammation, providing relief from the symptoms associated with an enlarged prostate. But what made this remedy even more remarkable was its accessibility. Unlike many modern pharmaceutical treatments, pumpkin seed oil was something that could be produced and distributed easily and at a low cost. It didn't require complex equipment, extensive medical training, or huge financial investment. For the Soviet population, this made it an ideal solution for the common man, an effective, affordable treatment that could be easily integrated into daily life. Urologists across the Soviet Union were quick to adopt it as part of their routine care for patients suffering from BPH, and it soon gained a reputation for its effectiveness. The widespread use of pumpkin seed oil in Soviet healthcare is a testament to the ingenuity of the era's medical professionals. Despite facing a lack of resources, Soviet doctors were able to provide their patients with treatments that not only worked, but also had minimal side effects compared to the drugs and surgical procedures available today. This approach to healthcare, which emphasized practical natural solutions, can be seen as a precursor to modern integrative medicine, where the focus is on combining traditional remedies with contemporary science. Today, the potential benefits of pumpkin seed oil for prostate health are supported by a growing body of research. Modern studies have confirmed its effectiveness in reducing the symptoms of BPH, and it is now widely available in health stores and online. While it may not be the sole treatment for prostate issues, it represents a valuable tool in managing prostate health, particularly when combined with other lifestyle changes like diet modification and regular exercise. And, unlike many pharmaceuticals, it is a low-risk, natural option that can be used alongside other treatments without significant side effects. As we continue to explore this Soviet remedy, it's important to recognize that it's not a one-size-fits-all solution. While pumpkin seed oil offers significant benefits for many men, it should be considered as part of a broader approach to prostate health. In the next section, we will take a closer look at how modern science has evaluated the use of pumpkin seed oil and similar treatments, examining whether they hold up to today's standards of medical efficacy and safety. As modern medicine continues to evolve, one might wonder whether the treatments used by Soviet doctors, such as pumpkin seed oil, are still relevant in today's world of advanced pharmaceuticals and high-tech procedures. While it may seem that the medical landscape has drastically changed, the principles behind these natural remedies continue to hold value. In fact, a growing body of research is supporting the effectiveness of pumpkin seed oil and other similar natural treatments, validating many of the traditional methods used in Soviet healthcare. Recent studies have found that pumpkin seed oil does indeed have significant benefits for prostate health, particularly for men suffering from benign prostatic hyperplasia BPH. Research conducted over the last few decades has highlighted the anti-inflammatory and antioxidant properties of pumpkin seed oil, both of which are key in reducing prostate enlargement. One study, published in the Journal of Medicinal Food, showed that pumpkin seed oil, when taken regularly, could reduce the severity of urinary symptoms in men with BPH. In this study, participants who took pumpkin seed oil reported improved urinary flow, reduced nocturia, frequent nighttime urination, and less urgency, all common symptoms of an enlarged prostate. Another important aspect of pumpkin seed oil's effectiveness lies in its ability to inhibit the action of dihydrotestosterone, DHT, a hormone responsible for prostate growth. DHT is produced when testosterone is converted by the enzyme 5-alpha reductase, and high levels of DHT are associated with an enlarged prostate. Pumpkin seed oil contains compounds that help to block the conversion of testosterone into DHT, making it a natural anti-androgenic agent. This mechanism of action mirrors that of prescription medications like finasteride, which are commonly used to treat BPH by reducing DHT levels. However, unlike finasteride, pumpkin seed oil carries no significant side effects, which makes it an appealing alternative for those seeking natural options. While the scientific community continues to explore the full range of benefits offered by pumpkin seed oil, its potential for prostate health is not the only reason to consider it. Beyond the prostate, pumpkin seed oil is known for its general health benefits. It's packed with essential fatty acids, particularly omega-3 and omega-6, which are vital for heart health and inflammation reduction throughout the body. These fatty acids also support the immune system and help maintain skin and joint health. Additionally, the zinc found in pumpkin seeds is crucial for overall immune function and the maintenance of healthy testosterone levels. For many men, turning to natural remedies like pumpkin seed oil can be an appealing first step before considering more aggressive medical treatments. In fact, some studies suggest that combining pumpkin seed oil with other supplements, such as saw palmetto and pyjum, may provide even greater relief from BPH symptoms. These herbal remedies have long been used in traditional medicine for prostate health, and contemporary research supports their synergistic effects when used together. Saw palmetto, for instance, has been shown to inhibit DHT production, much like pumpkin seed oil, and pyjum helps to reduce inflammation and improve urinary flow. However, it's important to note that while these natural treatments can be highly effective for many men, they are not a replacement for professional medical advice. Men with advanced BPH or those experiencing severe symptoms, such as complete urinary retention, should consult with their healthcare provider before attempting any new treatment. In some cases, medications or even surgery may be necessary to effectively manage the condition. Nevertheless, the integration of natural remedies into one's healthcare regimen can provide valuable support and relief. Nevertheless, the integration of natural remedies into one's healthcare regimen can provide valuable support and relief, particularly for those in the early stages of BPH. Moreover, it's essential to recognize that prostate health is not just about treating symptoms, but about preventing the onset of problems in the first place. A healthy lifestyle that includes regular exercise, a balanced diet rich in fruits, vegetables, and healthy fats, and regular checkups with a urologist can go a long way in preventing prostate issues. Even in the absence of symptoms, regular screenings are recommended for men over the age of 50 to monitor prostate health and detect any potential problems early. As we look at the history of prostate treatments, from Soviet-era remedies to modern-day scientific advancements, it becomes clear that prostate health is a multifaceted issue that requires both prevention and active management. Natural remedies like pumpkin seed oil offer a simple, affordable option for men to improve their prostate health and alleviate symptoms without resorting to expensive medications or invasive procedures. At the same time, they serve as a reminder of the value of integrating natural, time-tested remedies with the latest advancements in medical science. In the next section, we will explore some of the practical ways to incorporate pumpkin seed oil into your daily routine, as well as some lifestyle tips that can further enhance prostate health, whether you're looking to prevent prostate problems or alleviate the symptoms of BPH. This section will provide you with actionable steps to take control of your health. As we move forward, it's important to focus on practical strategies that can help men maintain and improve their prostate health. While pumpkin seed oil is certainly a key component of this approach, it's not the only solution. Maintaining prostate health involves a holistic approach that combines natural remedies with healthy lifestyle choices, nutritional adjustments, and consistent monitoring. These changes can make a significant difference, not only in preventing prostate problems, but also in alleviating the symptoms of benign prostatic hyperplasia, BPH, and improving overall well-being. Incorporating pumpkin seed oil into your daily routine is a simple and effective way to begin supporting prostate health. The recommended dosage typically ranges from 1 to 2 tablespoons of pumpkin seed oil per day. This can be taken directly, added to smoothies, or drizzled over salads. It's a versatile addition to your diet that offers a variety of health benefits, from supporting the prostate to boosting heart health and reducing inflammation. Many people find that incorporating this oil into their meals is a convenient way to ensure they're getting the right nutrients, especially since it contains essential fatty acids, antioxidants, and zinc, all critical for prostate and overall health. In addition to using pumpkin seed oil, it's essential to consider dietary changes that promote prostate health. A diet rich in fruits, vegetables, and healthy fats is crucial for maintaining prostate function. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds known as sulforaphanes, which have been shown to have protective effects against prostate cancer and other prostate-related issues. Tomatoes, rich in lycopene, are another powerful food for prostate health, as lycopene has been linked to a reduced risk of prostate cancer and improved prostate function. Omega-3 fatty acids, found in fatty fish such as salmon, mackerel, and sardines, also play a key role in reducing inflammation and supporting overall prostate health. At the same time, it's important to reduce the intake of foods that can contribute to prostate problems. Reducing the consumption of red meat, particularly processed meats, can help lower the risk of developing prostate issues. Studies have found that a diet high in red meat and low in fiber can increase the risk of prostate cancer and may exacerbate symptoms of BPH. Alcohol consumption should also be moderated, as it can irritate the bladder and exacerbate urinary symptoms. Similarly, limiting the intake of sugary foods and refined carbohydrates is important, as these can lead to weight gain and obesity, которые являются известными факторами риска для проблем простаты. Regular physical activity is another key element in maintaining prostate health. Studies have shown that men who engage in regular exercise, particularly aerobic exercise, have a lower risk of developing prostate issues, 49%, including BPH and prostate cancer. Exercise helps to regulate hormone levels, reduce inflammation, and promote overall circulatory health, all of which contribute to a healthy prostate. In addition, exercise can help manage body weight, reducing the risk of obesity, a known risk factor for prostate enlargement. Aim for at least 150 minutes of moderate aerobic activity per week, such as brisk walking, plavanie, или velosport. For men with existing prostate issues, pelvic floor exercises, also known as Kegel exercises, can be highly beneficial. These exercises strengthen the muscles of the pelvic floor, improving bladder control and reducing symptoms like frequent urination and the feeling of incomplete bladder emptying. To perform Kegel exercises, simply contract the muscles you would use to stop the flow of urine, hold for several seconds, and then relax. Aim for 10 to 15 repetitions, 3 times a day. Over time, these exercises can significantly improve bladder control and reduce the discomfort associated with an enlarged prostate. Aside from diet and exercise, it's crucial to manage stress, as chronic stress can have a negative impact on overall health, including prostate function. High stress levels can lead to increased levels of cortisol, which in turn can negatively affect hormone balance and prostate health. Practicing relaxation techniques such as deep breathing, meditation, or yoga can help reduce stress and improve overall well-being. In fact, mindfulness and stress management have been shown to positively impact prostate health, helping to reduce the inflammation and hormonal imbalances that contribute to BPH. Finally, regular medical checkups and prostate screenings are an important part of any prostate health strategy. While many men may not experience noticeable symptoms, routine screenings can help detect potential problems early when they are easier to treat. Men over the age of 50 should schedule annual checkups with a urologist to monitor prostate health and discuss any concerns. For those with a family history of prostate cancer or other risk factors, screenings may need to begin earlier. By combining natural treatments like pumpkin seed oil with a healthy diet, regular exercise, stress management, and routine medical care, men can take proactive steps to support their prostate health. Prostate problems may seem inevitable as men age, but with the right approach, they don't have to be a source of ongoing distress. By focusing on prevention, early intervention, and natural solutions, men can significantly improve their quality of life and continue to enjoy optimal health well into their 70s поздние годы.